The $1 million advertising campaign is one that you probably have seen on TV, on Facebook, or on billboards around the state. And it was one of those ads that caught Mike Kelly's attention in December. So he checked out Health Source RI's website and quickly got the answer he was looking for.
You can just go on and give basic information and it'll give you the costs. And the cost is about a third of what it costs to buy a plan on my own directly through an insurance company.
Health Source RI is the vehicle to make the Affordable Care Act, Obamacare, a reality in Rhode Island. And it was designed for people like Kelly and his wife, who own this business in Barrington. They have no other employees, so Kelly was just looking for insurance to cover them and their 2 sons.
Before I completed enrollment, I called, and I had the girl go through my entire application with me before I submitted it to me. I didn't want to submit it, and then it went up 3 times is what it said. And she went through, she says, no, that's your cost. Go ahead and submit it.
That was December 4th. He got confirmation the next day, and he made his first payment immediately. He would periodically check his account on the website.
Money cleared.
Right.
They said, we have our cards. It started January 1st. We got all the welcome packages from the insurance companies.
So you figure you're part of the family.
Yeah, I'm all set. And then it said I was disenrolled. I didn't even know what that meant, disenrolled. So I called, and that's where the nightmare began.
Over the next month, Kelly would be disenrolled and re-enrolled repeatedly without ever touching his account. He talked to 15 different people, mainly at this call center in Providence, but also one in Florida. Because he didn't have coverage, his wife had to cancel 3 scheduled doctor's appointments, even though they had paid their premiums.
21 and a half hours on the phone to get it straightened out. I used to time it on my, because I couldn't call from my business phone, and my cell phone has a timer on it. So every time I got on the phone and ended the conversation, when I ended the conversation, I wrote down how long I was on the phone for.
Kelly is not alone, and his situation mirrors that of many who have contacted the Hummel report over the past several weeks. They want the insurance, but are having problems with the logistics of getting enrolled.
As far as I'm concerned, it's not acceptable.
Christine Ferguson is the director of Health Source RI, which she says has been working to deal with a higher than expected number of people wanting to enroll.
The percentage of people who've had significant problems are relatively small in the larger scheme of things.
But that doesn't matter to him.
But that doesn't matter to the person who's got the problem. Right. And what we're striving for is 100% and excellent customer service across the board.
The numbers tell the story. In the first 4 months, Health Source RI has had more than 16,000 people enroll. The Medicaid enrollments exceed 35,000. Many of those people either came to the headquarters in Providence or contacted this call center in an adjacent part of the building. The center through February 8th had received more than 179,000 calls. A total of 16,000 people walked into the center for help, and close to 500,000 people have visited the website.
One of the things that we did was ramp up the number of people because we were slammed. We didn't expect the level of response that we got, so we underestimated. So we've brought in another 30 people, and they've been trained.
They speak to you, and they said, I have to speak to a supervisor. And I'm like, just put the supervisor on the phone. Let's cut it out, because this is taking forever. No, they don't get on. The supervisors don't get on the phone.
In 1 week alone, he spent 560 minutes, more than 9 hours, with representatives from the call center. Kelly spent so much time on the phone, he got a text message he was about to go over his cell minutes, something he's never done in 7 years.
They're pleasant. They try to help. I think they're way undertrained. They might just be throwing people in there because of the volume of the phone calls and not giving them a chance to be trained properly. They all give you a different answer. They all say they'll call back, and none of them do.
Did you feel your people were trained well enough going into it?
I think they were trained as well as they could have been at the time. So again, if you look at the...
Is that because of deadline? Because
it's a deadline.
New issues?
It's a deadline. Listen, no private sector company would have brought something up this fast. No private sector company would have had 5 federal data hubs that they had to relate to, plus all of the carriers.
They just cannot stop apologizing. I said, all right, I get it. You're sorry.
Get it done.
Let's fix it.
Right.
Yeah, I'm not mad at you personally. So just let's move on. And I can't be the only person that's been enrolled and disenrolled, because they were quite familiar with what was going on.
It wasn't like you were a new case.
No.
No one ever thought, including me, that this would go off without a hitch. So there are problems that we built in a mechanism, a series of mechanisms, to address those problems as they come up.
We showed Ferguson the sheet Kelly had printed out with the travel of his travails.
As you see that, what are you thinking? Enroll, disenroll?
I'm thinking
enroll?
it's crazy. So I'm thinking that this isn't what's supposed to happen, and it's not what we're striving toward, and I know that in a percentage of cases it has.
Before our interview last week, Kelly thought he had straightened everything out, but he contacted us on Monday to say he'd been disenrolled again. That prompted a call to him from Ferguson personally.
I know normally people are always trying to defend. Oh, there's not a problem, there's not a problem. I'm not trying to defend, right? We absolutely know that we're going to encounter all kinds of issues as we go along. We've built in ways to deal with them. It's critically important that people let me know when there are problems.
She remains upbeat about what she believes HealthSource RI can do in providing coverage.
We have a shot at really having an impact on cost of healthcare, how healthcare is delivered, and finally, for the state, actually having the kind of data and analytics that answer the questions about where our money's being spent and how it's being spent.
Mike Kelly agrees with that, but says the state needs to walk before it can run.
The message is train your people. Train them. Don't let someone just answer the phone that doesn't know what they're talking about. You have to train them.
In Providence, Jim Hummel for the Hummel Report.